Good evening, everyone, and welcome to this webinar on the use of the Women's Treasures remedies for menopausal problems. Before starting, I just wanted to draw your attention to my various websites. And I've sent all of you a handout, so you will have this in the handout. And just a few words about your control panel to explain what it does. With this red arrow here, you can expand the control panel. And I would suggest that you keep it expanded. This button here enlarges the panel to the full screen, which I would not advise to do. With this button here, you can raise your hand to draw my attention. And you are muted for this webinar, so you can't speak to me or ask questions. The reason for that is that if everyone was not muted, there would be a lot of background noise. But you can ask questions in the questions panel, and that's probably the most important thing to draw to your attention. So if you have any questions, you can write them there, and I will answer them when there is a suitable break in the lecture. So don't expect me to answer the question immediately after it's written down. And if you leave the seminar, this is the audio setup. And if you want to leave the webinar, you just click on the X in that corner. So let's start. And menopause indicates a period of life in a woman's life when the production of estrogen starts decreasing. And it is necessary to have at least 6 to 12 months to elapse before establishing a diagnosis of the menopause. A more correct word for menopause would be climacteric, which would indicate the phase in a woman's life when there is a transition from a reproductive to non-reproductive stage. However, that word is not used very often, and I will keep using the term menopausal syndrome rather than climacteric syndrome. First of all, let's remember the first chapter of the Suen, the very first chapter of the Suen that talks about life cycles of 7 years for women and 8 years for men. And there's a very interesting phenomenon here. According to the Suen, women's life cycles are ruled by number 7, and puberty occurs at 14, 7 times 2. And the menopause occurs at 49, 7 times 7, where the Suen says that the kidney gene declines and she can no longer conceive. There's a very interesting phenomenon here. What is that? That the Suen was written about 100 BC. And according to this chapter of the Suen, the menopause occurs around the age of 49. And that is remarkably close to the average statistical age of modern women when the menopause occurs around the age of 51. So 51 and 49 are remarkably close. And why is that interesting? It's very interesting because the Neijing was written around 100 BC. And if we believe what they say about life expectancy, in those times, hardly any woman would even reach the age of 49. So how did these people know that the menopause occurs at 49? I believe that they knew because they recognized cosmic cycles influencing women's physiology and pathology. And interestingly, the average age of menopause is more or less the same all over the world, which would seem to indicate that it's not a cultural influence phenomenon, as anthropologists might say. But it is a phase of the woman's life that is subject to cosmic cycles. From the Western medicine point of view, Western medicine takes a very kind of materialistic view of the menopause, being due to the decline of estrogen from the ovarian follicles. But there is another very interesting aspect to this, that the ovarian follicles are already in the fetus, in the female fetus. Of course, they are primordial follicles, and there are 6 million, decreasing to 600,000 at birth, 300,000 at menarche, and about 10,000 at the time of the menopause. And these pictures here illustrate this phenomenon. So that's very interesting. Why is that interesting? Because it shows that the decline of kidney yin is not something that just happens when a woman is 50, 51, 52, and due to the ovarian follicles not producing so much estrogen. But it's a gradual decline of kidney yin, which starts even before, even in the fetus. And being a gradual phenomenon throughout a woman's lifetime, it means that it's influenced by lifestyle habits. And that's a very important aspect of Chinese medicine and of the Chinese view of menopausal problems. It's not just something that happens when a woman reaches the menopausal age, but it is something that is influenced, that is affected by her lifestyle throughout her life. And this, I always took this into account when advising women, and I will clarify that in a moment. So Chinese medicine, as you all know, of course, takes a much more holistic view of the menopause. It's not just due to the ovaries not producing estrogen anymore, but it is definitely influenced by life habits throughout her lifetime. And therefore, it is affected by things like diet, of course, as we all know, overwork, smoking, etc. But I will come back to this very soon. So what are the main symptoms of the menopause? Hot flushes. In the United States, they call them flashes. In England, flushes. Vaginal dryness, sweating. I would say the top three are the main ones, the most common ones, and the most typical ones. Besides that, there can be very many other symptoms which are influenced also by other factors. So if we see a menopausal woman with classic menopausal symptoms like hot flushes, and then she has many other symptoms, she may have loose stools, she may have abdominal distension, anxiety, insomnia, tiredness, depression. Some of those symptoms may not be strictly menopausal, but are due to the influence of our lifestyle in the years leading up to the menopause. As you can see in this slide, the most common symptom is hot flushes. 85% of women have them, and a very high percentage, 45, still have them after 5 years or even 10 years. And during this lecture, I'm going to ask you some questions. We have some polls to get some feedbacks from you. And this is the first one. And you can vote, so to speak, to tell me which is the most common menopausal symptom that you see in your practice. So you can start voting now, so to speak. And we can already see some interesting things coming up. Actually, very interesting. Okay, people are still voting. I think we're probably, yes, I think we're probably finished. So it has to be, it was to be expected. The 66% of you roughly consider hot flushes the most common symptom. And also interesting, 13% see anxiety and 7% insomnia. So there's a very high percentage of mental emotional symptoms, which is definitely the case. And surprising, there's one surprising result here. One surprising result in that only 3% of you mentioned vaginal dryness. That's a little bit surprising. In my practice, it would have been much higher than that. So there are two interesting things here. One, that it confirms that overwhelming majority of you see hot flushes as the main symptom. And two, the mental emotional symptoms, insomnia, anxiety, depression, which we definitely see. Now, there's another very interesting aspect to consider, and it's that the production of estrogen does not stop just like that. The woman reaches the menopause and the production of estrogen stops dead. It doesn't. There is still a very small production of estrogen going on, some of it from the adrenal glands, and some of it, interestingly, from adipose tissue cells, fat cells, which is an interesting, also from the Chinese point of view, because adipose tissue cells go on producing very small amount of estrogen, which means that women who have some adipose tissue do better than very thin women. And that would make sense from the Chinese point of view. Why? Because being very thin is often a sign of yin deficiency. And yin deficiency definitely aggravates menopausal symptoms. Now, from the Chinese point of view, menopausal symptoms are due to decline of kidney yin. And one thing I want to stress quite strongly is that the decline of kidney yin can occur in its yin or yang aspect. And it's probably, if that's the only thing you learn from this webinar, it will have been worth it. I hear very often that menopausal symptoms are due to kidney yin deficiency. That is not true. I can tell you that in my practice, in the menopausal women I see, probably half have a pale tongue and have kidney yang deficiency. We'll see in a moment how you can have hot flushes if you have kidney yang deficiency. But that's one thing I wanted to stress. Menopausal symptoms are due to decline of kidney yin, which can be yin or yang. So you can have kidney yin deficiency with the predominance of yin deficiency, or kidney yin deficiency with the predominance of yang deficiency. Moreover, in addition to that, there are many other patterns in the menopause. It's not just kidney deficiency. And some full patterns, which are listed here, especially empty heat, of course, and liver yang rising. Those are fairly common. But there may also be full patterns such as blood stasis, chi stagnation, or dampness. And by the way, I am talking primarily about the physiological menopause, i.e. the menopause that occurs around the age of 50. I'm not talking about premature menopause in young women. That is a completely different pathology. And in fact, one other thing I wanted to stress is that the menopause is not a pathology. It's a normal transition, a normal cycle in a woman's life. It is not a pathology, it is not a disease. It only becomes a pathology if the menopausal symptoms are very pronounced and very distressing. So there's a very big difference between the natural menopause, which is strictly speaking not a pathology, not a disease, and the premature menopause in a young woman, which is a pathology. So this slide here emphasizes what I said a few minutes ago. Jing has a yang and a yin aspect. And the yang aspect of Jing is the minister fire, which is actually formed at conception. If you look at this slide, the minister fire is the yang aspect of Jing, and it's formed at conception. The sperm and ova, which are the yin aspect of Jing, mature at puberty. And that's why some Chinese books call the minister fire the prenatal of the prenatal, and the tiangui the postnatal of the prenatal. By tiangui, I mean the ovarian follicles and the estrogen and menstrual blood. That's called tiangui. And that's what the first chapter of the Suwen talks about. It says when the girl is 14, the tiangui arrives and she can conceive. So tiangui represents the maturation of the ovarian follicles, and sperm in men and ova in women. And likewise, the same chapter says when the woman is 49, the tiangui dries up and she can no longer conceive. So that's one thing I wanted to stress. The Jing has a yang and a yin aspect, and indeed the yang aspect is there before the yin aspect. And this is confirmed by this. There's an interesting quotation in this book, the Yi Zhong Jing Jian, the Golden Mirror of Medicine, which says at 7 the kidney qi is abundant, and the yuan qi, it calls it there the dung qi, and it means yuan qi. The yuan qi is abundant. So notice what it says there. The yuan qi and the minister fire are there already when the girl is 7. And then at 14, the tiangui arrives. So it takes about 14 years for the kidney qi, the yuan qi, to mature into its yin aspect, which leads to the maturation of the ovarian follicles. So that's what this slide is highlighting at the bottom here. It says the minister fire is present at conception, and it takes 14 years in girls and 16 in boys for that to produce tiangui, which is sperm and ova, which happens at puberty. The minister fire, by the way, is the physiological fire of the kidneys. I stress physiological. It's not the pathological, not the pathological fire. So let's talk briefly about the etiology of the menopause. And I should say straight on that this is a contradiction, because a few minutes ago I just said that the menopause is not a disease, and it isn't. It's not a pathology. So if it's not a disease, how can we talk about etiology? We do, because these etiological factors are not the causes of the menopause, because the cause of the menopause is the decline of kidney Jing, but they are definitely factors which will aggravate it, and that is a very much a fact in all the patients we see. So the first one, as you all know, is emotional stress. And various types of emotions, well, basically all emotions can affect the menopause, but especially those that tend to weaken the kidneys, such as fear, pensiveness, and worry. And I know that some of you may be surprised of the inclusion of worry, but we should not see the relationship between one emotion and one organ too rigidly. Everyone would associate worry with the lungs, and I do too. But worry affects the kidneys too. And there is a famous chapter in the book by John Jing that confirms this. So emotional stress, as you all very well know, is a very important factor which will aggravate the menopause. And I mean emotional stress throughout the woman's life, not just when she's 50 or 51 or 52. The second etiological factor, which in my opinion is extremely important, extremely common, is overwork. And overwork not in the sense of physical work, but overwork in the sense of working long hours, getting up early in the morning, getting a train, coming back late at night. And overwork in this sense is also associated with two other etiological factors. One is irregular diet, and the other is also emotional stress. So under this heading of overwork, it actually also includes emotional stress and irregular diet. For example, I always ask my patients who what they do for lunch, and nearly all of them will say that they eat a sandwich at their desk while they're working. And overwork, in my opinion, is a major cause of kidney deficiency in the patients we see, and especially kidney yin deficiency. And I stress again, I'm not talking about overwork when a woman is 50, but overwork throughout her lifetime. Third is smoking, which is often not actually seen as an etiological factor, but I think it's a fairly important one in the menopause because it dries up blood and jing. And I wanted to show you a couple of slides that talk about tobacco in Chinese medicine. Tobacco was introduced in China in the Ming Dynasty, 1571. And interestingly, Chinese doctors started investigating this plant, which I had never seen before, to see if it could be used as a medicine. And all the doctors concluded that it cannot. Notice what this book says, the Gen Nam Wen Sao. Tobacco is pungent in taste, which is interesting. It's hot and toxic without any medicinal effect. But notice what these other doctors say here. Tobacco is pungent and drying. It burns the jing and the fluids. So that's a very, very interesting statement. In Western medicine, we concentrate a lot on the effect of tobacco on the lungs, which they do, but they burn the kidney jing. They dry up, it's drying. So it's, for women who smoke, I would say it's a fairly important etiological factor which would aggravate the menopausal symptoms. Yet another very common etiological factor, as you all very well know, is irregular diet. And I've noticed that phlegm would aggravate menopausal symptoms, mostly by obstructing the circulation of qi and making qi go up. And I will say more about this in a moment. And you're all very familiar with the foods that lead to phlegm. Dairy foods like cheese, butter, milk, but also sweets and sugar. Although, remember what we said a few minutes ago, yin deficiency tend to make someone thin, while phlegm may tend to make a person relatively overweight. So there is a balance to be struck, as we just said a few minutes ago, that adipose tissue cells secrete a very small amount of estrogen. But of course, if a woman is obese, that would counteract that minimal positive effect of adipose tissue producing estrogen. And yet another etiological factors is tea, coffee, and alcohol, which are hot in energy and therefore would aggravate menopausal symptoms and especially hot flushes. So bearing in mind these etiological factors, it has completely changed my approach to the advice I give women. It actually hasn't changed my approach to the advice I give, but when I give this advice. And I think that's the best service we can provide to women. I advise young women about the menopause. If I have a patient who, say, a woman is about 34, 35, she's working a lot, overworking, bad diet, smoking, drinking, I tell them now is the time to do something about the menopause. And this is the list of advice that I give them about overwork, exercising in moderation, not smoking, drinking in moderation, avoid emotional stress, which is easy to say, difficult to do. And this is, in my opinion, the best advice we can, the best service we can provide for young women. And I quickly want to answer a question about vaginal dryness, which I can see there. How do you treat it? I would say very, very briefly, lung 7 and kidney 6, which are the points to open the Ren-May. And I'm going to discuss acupuncture in a moment. I would say that when I treat a menopausal woman, I would probably nearly always use the Ren-May, lung 7 and kidney 6, plus Ren-4. In fact, I would say that I would probably use those 3 points always. And to treat vaginal dryness, basically I use Ren-4, but other points that nourish in, such as spleen 6, will be important, and kidney 3 will be important. Now notice at the bottom of this slide I have a link for a newsletter on my website on phytoestrogens. There's a lot of discussion on phytoestrogens. I will say a few things about them, but we don't really have time to have a full discussion of them, and I advise you to read that newsletter on phytoestrogens, i.e. the estrogens, phytoestrogens in plants. And these foods here, the tofu and soya foods, are rich in phytoestrogens. And there is a big debate on these. There are those who say that they are really, the women should not really use them, and those that say they should. I personally think that they are beneficial. And one factor which would seem to indicate this is that Japanese women, who have a lot of those types of foods, have far fewer menopausal problems than Western women, and the rate of breast cancer is 6 times lower than that in the UK. And there are those who say that the phytoestrogens are like estrogens and they could stimulate estrogen-dependent breast cancer. I personally do not think so, because the effect of phytoestrogens is more complex than just taking estrogen. And we have a second poll here. i.e. what is the most common etiological factor in your opinion? So you can start voting, so to speak. And I can already see some interesting results. %60 of you have voted. The votes are coming in. Okay, people are still voting. Okay, let's okay, there's some very interesting results. The overwhelming majority, about 85%, consider emotional problems and overwork together as major etiological factors. And I would totally agree with that. But there's a very surprising result. No one considers smoking as an etiological factor. I would say that it is, and it's probably underestimated. And I'd like to answer quickly another question. What would you say about the influence of female sex hormones and infertility treatments on menopausal symptoms? Yes, I definitely think there is a connection, and I personally discourage any hormonal manipulation, whether it's the contraceptive pill, whether it's the heavy hormonal manipulation that is used for infertility treatments, and the hormonal manipulation that happens during the menopause with HRT. And I would say that the hormonal manipulation, especially the one for infertility, actually damages kidney gene. And Dr. Shen, one of my teachers, and also mentioned that, and also Dr. Xia, the great gynecologist in Nanjing, believed that the hormonal manipulation that is used for infertility treatments actually damages the ovaries and the kidney gene, so it would make menopausal problems worse. And I always discourage hormonal manipulation because women are subject to hormonal manipulations anyway from the environment, for example, in plastics, in food, etc. So I always advise women against that. So in this slide here, I make the point that we should not forget the full patterns, whether they are the result of the menopause or not. Any menopausal women around that age, 50, 55, will have some full patterns. Chi stagnation, blood stasis, phlegm, and others, which need to be treated as well. So it's not just a matter of tonified kidney gene and that's it. I always treat other patterns as well. And if the woman's pathology is quite complex, then I may use a custom formula rather than ready-made formula to address other patterns than kidney gene deficiency. For example, if there was blood stasis, I would use a formula like Gusha Juyu Tang, variation of, or if there was phlegm, I would use a variation of Archen Tang. But in the majority of cases, in menopausal women, I use ready-made formulas. Now let's look at this diagram here. It's a very important diagram of the pathology of menopause, which explains how a woman can get hot flushes with kidney yang deficiency. So on the left, we have a woman with a primary kidney yin deficiency. The blue is yin and the red is yang. And that's very easy to explain the hot flushes. Kidney yin is deficient. That leads to empty heat rises, and it causes hot flushes. But notice that both yin and yang are below the line. And that's the most common situation in the menopause. So the menopausal women I see, the by far the most common situation is a simultaneous deficiency of both kidney yin and kidney yang. And therefore you should not be surprised of the coexistence of hot and cold symptoms. For example, in the woman on the left, she will have many symptoms of empty heat. But notice there is also cold feet and frequent urination. And I repeat, this is by far the most common situation, i.e. a simultaneous deficiency of both kidney yin and kidney yang. On the right side, we have a woman with kidney yang deficiency. But notice the yin is also below the line. And that explains that even in the woman with kidney yang deficiency, there is a slight deficiency of kidney yin leading to empty heat. And therefore, if you look at this woman, she will be feeling cold feet, frequent urination, but hot flushes. And this happens all the time. And I would say that roughly half of the menopausal women I see have kidney yang deficiency and therefore a pale tongue. And I want to stress it again, just because they have hot flushes, it doesn't mean that they have kidney yin deficiency only. And the tongue is very important to diagnose yin deficiency. In this slide here, we have 5 tongues indicating kidney yin deficiency. Notice there are 5 very different tongues. Why is that? Because there are many different degrees of kidney yin or yin deficiency. A yin deficiency manifests on the tongue through lack of coating. If you look at the top, the one on the top left, you probably find it difficult to see, but that coating is rootless, and rootless coating would be the very beginning of yin deficiency, the mildest form of yin deficiency. On the top right, some of the coating is missing, so the yin deficiency is worse. The one in the middle on the left, there is no coating at all, and therefore the yin deficiency is more advanced. The one in the middle on the right also lacks a coating but is red, so there is some empty heat. So that's something else I wanted to stress. Yin deficiency leads to empty heat, but you can have empty heat, but you can have yin deficiency without empty heat. And the tongue on the bottom would be the most advanced type of yin deficiency. The tongue is red and without coating, which means that there is very advanced yin deficiency with strong empty heat. And these two tongues here are pale tongues. The one on the right is pale and dry, the one on the left is pale and very slightly wet. So if I should give you an advice with tongue diagnosis, if the tongue is pale, like these two, tonify kidney yang. In every other case, even if the tongue is relatively normal, I would say nourish kidney yin. There is something else I want to draw your attention to, that when we treat menopausal women, we should not see it purely in terms of patterns. Kidney yin deficiency, kidney yang, liver yang rising, etc., etc. A lot of the menopausal symptoms are due to qi, to an imbalance of qi, which is more of an acupuncture perspective of it. And one thing that happens in the menopause is that the chung mei and the ren mei become destabilized. The Chinese say bu gu, without root, without foundation. Because the kidney jing declines, the chung and ren are kind of destabilized in the lower burner. And that has two effects. One is that qi will tend to rise. Because it's deficient in the lower burner, some qi will tend to rise, and that would aggravate the hot flushes. So we should not, as I said, see all the pathology in terms of patterns, like hot flushes, so there must be some heat. It's also due to the qi rising, and therefore we need to stabilize chung and ren, and I'll show you in a moment how you do it. Another interesting consequence of the destabilization of chung and ren, that it causes qi to deviate from its pathways, which is interestingly one of the characteristics of children. In fact, in children, qi is easily deviated from its pathways, and the similar kind of thing happens when the chung and ren become destabilized. And that could give rise to other types of symptoms that you would not relate to the menopause, like, for example, urinary problems or bowel problems due to the qi being deranged and deviating from its pathways. So I was making here the point that we should not necessarily see everything in terms of patterns, but also in terms of destabilization of qi, which is more of an acupuncture perspective. And the chung mei rebellious qi is an aspect of what I just mentioned, this destabilization of chung and ren. And here on the right side is a representation of the chung mei pathway. It starts in the lower burner and it goes up the kidney channel to the face, and it also has a descending branch of the chung mei that goes in the inside of the legs and to the feet. So on the right side is a schematic representation of the chung mei. And notice how the chung mei is a unique channel, because from the lower burner it goes in two directions. It goes up to the face and down to the feet. And what happens in rebellious qi of the chung mei is that as a result of this destabilization, the qi goes up and may cause a feeling of heat and hot flushes. And because it's going up, it's deficient in the legs and may cause cold feet. So we may have contradictory symptoms of heat and cold, not to do with empty heat or full heat or etc., but simply to this destabilization of qi in the chung mei. And this is a very important aspect of it. This is not the cause of the menopause. This is more the result of the destabilization of qi, but it is something that will aggravate the hot flushes. And how do we know that there is this chung mei rebellious qi? We know that from a set of symptoms, which are highlighted in this slide here. And I'm highlighting them from the bottom up. There are lower abdominal symptoms, together with some menstrual symptoms, irregular periods, and abdominal fullness, distension, or pain. And this also affects the umbilical region, the epigastrial region, and the apochondrium. And the breast, because the chung mei diffuses over the breasts. It also affects the heart with palpitations, a feeling of lump in the throat, sometimes headaches, the feeling of heat in the face, and a feeling of anxiety. You don't have to have all these symptoms to diagnose rebellious qi of the chung mei, but as you can see in the box on the left, you do need 3 or 4 of these symptoms at different levels to diagnose rebellious qi of the chung mei. I repeat, this is not the cause of the menopause. It is the result of this destabilization of chung and ren, and it is something that would aggravate the hot flushes. And most of all, it's also frequently a cause of anxiety. So what causes this rebellious qi of the chung mei? One possible cause is emotional stress, which makes qi go up, or a deficiency of the kidneys and the destabilization of qi in the lower burner. And this is what I do when I see that there is rebellious qi of the chung mei. This is the treatment I use. The 2 red points, spleen 4 and pericardium 6, open the chung mei. Then I use ren 4 and kidney 13. I use those 2 points practically in every case, I would say. ren 4 and kidney 13, they have the effect of stabilizing qi in the lower burner. They tonify the kidneys, the uterus, the jing. And kidney 13 is right next to ren 4, and kidney 13 is a chung mei point. Plus I use kidney 21 and ren 15 to subdue rebellious qi. And this is the basic treatment I use for rebellious qi of the chung mei. So let's look at the patterns. And I repeat, in my experience, I would say in a menopausal woman, there is nearly always a simultaneous deficiency of kidney yin and kidney yang, nearly always. So here we are talking about a simultaneous deficiency of kidney yin and yang with the predominance of kidney yin. And this time is a fairly good example of it, because the coating is missing nearly completely, which indicates yin deficiency, and is very slightly red in the center, so there is some empty heat, but not a huge amount of empty heat. So a typical symptom of yin deficiency will be also the dry mouth and throat at night. But probably the most objective symptom of it will be actually the tongue, i.e. the lack of coating on the tongue. As I said, I practically always use in a menopausal woman the ren mei, lung 7 and kidney 6, unless there is rebellious qi of the chung mei, in which I use more the chung mei with spleen 4 and pericardium 6. But those first 4 points I probably use in every menopausal woman: lung 7, kidney 6, ren 4, and kidney 3. And often I also use kidney 13, which is a chung mei point, which is not on this list, and which is right next to ren 4. It Hafetzun from ren 4. Another point I use frequently, which I think that not many people use, is kidney 9. Kidney 9 is a great point because besides tonifying the kidneys, it also calms the mind. And it's the beginning point of the yin wei mei. Spleen 6 also nourishes yin, and ren 7 also nourishes yin. And the Chinese prescription I use is Zuogui 1, which in the women's treasures is Ease the Journey Yin. Ease the Journey Yin is a variation of Zuogui 1 with the addition of herbs to deal with the empty heat and the hot flushes. And I've used this remedy a lot, and it's a very effective remedy. The second pattern is also simultaneous deficiency of kidney yin and kidney yang, but with the predominance of kidney yang deficiency. And we've already explained how that could be. And how do we know that there is a predominance of kidney yang deficiency? From the tongue, from the pale tongue. And from the presence of some cold symptoms, which seems strange, but it happens all the time. A woman may have hot flashes and feel cold as well. So I always ask them, apart from having hot flashes, do you feel cold in general? And these women will say yes, they do feel cold. They may have cold feet. And that is the reason that I formulated another formula called Is the Journey Yang, which is for women with the predominance of kidney yang deficiency. But it still has herbs to deal with the hot flushes and the empty heat. The empty heat derives from the fact that in addition to yang deficiency, there is also some kidney yin deficiency. And it's quite amazing how you can even use moxa in these women. It will not make the hot flushes worse. Notice that I use the ren mei, lung 7 and kidney 6, the same. And notice that I use ren 4, the same, and kidney 3. The points are nearly the same. The only difference is probably the addition of bladder 52 in the back. But the main difference the third pattern is kidney yin deficiency, kidney and liver yin deficiency with liver yang rising. And how do we know there is liver yang rising? From the symptoms that I've put in bold. The irritability deriving from the liver, some eye symptoms such as dry eyes, but especially headaches. And the tongue would be red without coating. And why do some women get this pattern? Obviously, women will get this pattern if the etiological factors is especially emotional stress. Then they may be more prone to this pattern. So the treatment is to nourish the yin of liver and kidneys and to subdue liver yang rising and calm the shen and the hun. And the remedy for this is called female treasure, which is, by the way, a variation of a Chinese formula, Kun Bao Tang, which is specific for menopausal women. Notice I always use the Rem-A, lung 7 and kidney 6. And how do I nourish liver yin? With liver 8, with kidney 3, and spleen 6, which is not on that list, but you could add it to that list. And points to subdue liver yang, such as the liver 3. And the points that I would use to calm the mind in this case are especially DO24 and gallbladder 13. It's a combination that I use a lot for anxiety, irritability, deriving especially from liver yang rising. And the fourth pattern is deficiency of yin of heart and kidneys with heart empty heat. So in this pattern, the heart is more involved. And how do we know it? We know it from the symptoms which are in bold. First of all, palpitations and Shen symptoms, insomnia, anxiety, and memory, poor memory. And this picture here is a great example of actually of this pattern because it lacks a coating, so it shows yin deficiency. It is red, which shows empty heat. And notice the tip of the tongue. It's redder, it's a different type of red, different shade of red, and it's swollen, it has red points. So that's a very, very clear indication of heart empty heat. Again, why would a menopausal woman get this type of pattern? This is also from emotional problems, if emotional stress is the main aggravating factor. And there is a very famous formula for this pattern, which is Tian Wang Pu Xin Dan, the Heavenly Emperor tonifying the heart pill. And my equivalent of that in the Women's Treasures is Heavenly Empress, which is a variation of Tian Wang Pu Xin Dan. And by the way, because Heavenly Empress is a variation of that formula, it can be used in men too. If a man has this pattern of heart and kidney yin deficiency with heart empty heat, they could take Heavenly Empress. Notice the points: lung 7, kidney 6, kidney 3, Rem 4, spleen 6, kidney 13. Notice how those are my the basic points I use. And there are some heart points: heart 6, heart 8, pericardium 7. And in particular, heart 6 and kidney 7 together treat night sweating. I haven't said anything about the dosage. In all these cases, these 4 patterns, we had Is the Journey Yin, Is the Journey Yang, Female Treasure, and Heavenly Empress. I would start with 4 tablets a day to start with. And if that doesn't work, you can always increase it to 6 a day. And or even more, but I usually start with 4, which is a low dose. Now, sometimes I combine Is the Journey Yin with Is the Journey Yang. And I do that when a woman has primarily a deficiency of kidney yang. So why do I do that? Because if a woman has primarily a deficiency of kidney yang, then we use Is the Journey Yang. But I combine the two if she has a deficiency of kidney yang and the hot flushes are very pronounced. In that case, I use both remedies. And you can use both remedies because they're actually variations of the same formula. And I use both remedies in a different dosage, as you can see in this slide. And when I use 2 remedies, by the way, I use them at different times of day. So I would use Is the Journey Yang in the morning, 3 or 4 tablets. with estrogenic yin, with only 1 or 2 in the evening. And this combination also works very well. And I repeat it, I do it when a woman has a deficiency of kidney yang, but the hot flushes are very pronounced. And I'm going to skip this poll because I've noticed that some people are having problems with this poll, so I'd rather not go ahead with this poll. I just wanted to show you the questions. What would be the most common pattern in your experience? Interestingly, in the United States, I see many more women with 4 and 5, i.e. deficiency of liver and kidney yin with liver yang rising, and deficiency of heart and kidney yin, more than the previous 2, probably from more emotional stress. Very briefly, premature menopause is a completely different problem, entirely different, and it is a pathology, unlike the normal menopause. And 2 patterns which may cause it are accumulation of phlegm with stagnation of qi, which is this one, in which case these are the remedies you can use. And the second pattern is blood stasis. But I'm not going to discuss this in detail because I want to concentrate more on the normal menopause. So to summarize how you choose your remedy, first of all, if the tongue is pale, there is no doubt you have to use estrogenic yang. Unless the hot flushes are very pronounced and you use both yang and yin. Number 2 is a very important advice. Any other tongue, even if it's normal, use estrogenic yin. So supposing you see a menopausal woman and the tongue seems normal, which happens, it does happen, I would start by using estrogenic yin rather than estrogenic yang. So the advice is very simple. If the tongue is pale, use estrogenic yang. In every other tongue, use estrogenic yin. If there are headaches and irritability, use female treasure because it shows the liver involvement. If there are insomnia, palpitation, anxiety, use heavenly empress because it shows the heart involvement. And this is a summary of the remedies that I use. There are 2 other situations that I need to mention because we see them all the time in our practices. One, we see women who had a hysterectomy, total hysterectomy, i.e. also oophorectomy, the removal of the ovaries. And 2, a woman who's had breast cancer and she's on tamoxifen, which blocks the production of estrogen. So what do? Will Chinese herbs still work? The answer is yes. Of course, not as well, but they will still work, and I do treat women in these 2 situations. So for a woman who's had her ovaries removed, they still respond to treatment, but of course they will be much more slow. But they do respond, and I definitely would encourage you to treat them. Also remembering that from the Western point of view, very small amount of estrogens are still produced by the adrenal glands and adipose tissue. So we can definitely treat these women. Of course, the results will not be as good as for women who still have ovaries. For women who are on tamoxifen, which stops the production of estrogen, the treatment is more difficult, but it still works. I still use the same remedies. And of course, the progress will be slower because it's like, as you can see from this picture, it's like adding water to a bucket that is leaking. But it still works. So I definitely would encourage you to treat these women. And we see these women, I see a lot of these women. Also, there is another very important point. The Chinese view of the menopause is more holistic. We don't, in Western medicine, they just give you estrogen and that's it. We're treated the whole person, all the patterns. There may be many other patterns, phlegm, stagnation, blood stasis, so that it will help the woman in general, and it will definitely help in a more holistic way. There are two questions that always come up, which I have on this slide. How long should the woman take these remedies for? And slightly tongue-in-cheek, my answer is forever. Plants do not contain hormones, and they don't work like Western medicine does with HRT. They work by gently stimulating the kidneys and slowing down, basically, the decline of kidney gene, the physiological decline of kidney gene. And therefore, there is no problem in taking these plants, these herbs, for a long time. The only precaution I advise that if anyone takes some remedies for a long time, whether it's women or men, to stop them every 9 months or so. Stop them for a month, every 9 months or so. And by the way, as you can see there, it says herbal medicine does not contain hormones. I hear it a lot, and I see it in writing too. And I don't know where this idea comes from, that dangui contains estrogen, dangui is angelica, contains estrogen, and it is contraindicated if women has breast cancer. I don't know where this idea comes from. Dangui does not contain estrogen at all, not even phytoestrogens, and there is no contraindication. In fact, if you check the Materia Medica, the Bensky Materia Medica and the Chen Materia Medica would confirm that. But it's something that I hear all the time, and I've also seen it in writing, that dangui has an estrogenic effect and it's contraindicated. So how long can she take these herbal remedies? For a long time. And the only precaution is stop them for a month after 9 months. The second question is very important. Can herbal medicine be combined with HRT, hormone replacement therapy, which in the United States is called ERT, estrogen replacement therapy? And the answer is yes, because they work in different ways. Basically, HRT works by tricking the hypothalamus and pituitary into thinking that the ovaries are still working. Because essentially, the hot flash, especially the hot flashes, the vasomotor symptoms, are due to hypothalamus and pituitary working overtime to stimulate the ovaries, because the ovaries are not responding, and that causes the hot flashes. So by giving the woman a very small dosage of estrogen, it will stop the hypothalamus and pituitary into trying to stimulate them, and that should help the hot flashes, and it usually does. Our herbal medicine doesn't work like that at all. It simply works by gently tonifying kidney gene, and therefore that by itself should reduce the hot flashes, and it does. However, of course, there is no point in taking HRT and herbs for a long time. There's no point at all in taking both. So the point I'm making is that if a woman comes to me and she's already on HRT, but the HRT is not controlling the symptoms very well, you can start the treatment, and there's no point in combining it with the herbs. But after a couple of months, I would want to stop the HRT. because there's no logic in taking both for years. I have a few case histories. Let's look at a couple of case histories to show you the variations that we see in practice. This is a 50-year-old woman. Her period had stopped years before, and she had hot flushes, night sweating, and notice symptoms that deviate from the normal menopausal symptoms. Hair loss, for example, nails breaking easily, and backache. And notice her tongue was pale, or slightly pale, which would indicate kidney yang deficiency. In her case, there was also some liver blood deficiency. And the hair loss I also attribute to kidney deficiency in her case. So I used Is the Journey Young because she had a kidney yang deficiency. But with the small dose of Is the Journey Yin, why that? Not only to reduce the hot flushes, but also to nourish blood more, because she had a deficiency of blood. So I thought it would be a good idea to combine it with Is the Journey Yin. And notice the dosages I used, only 2 of Is the Journey Yang and only 1 of Is the Journey Yin. And even at such a low doses, these remedies completely controlled the menopausal symptoms. This is a 53-year-old woman, 53 years old woman. Periods that stopped for 3 years. Severe hot flashes, night sweating, depression, anxiety, mood swings. Notice here in this case there's a lot more mental emotional symptoms. Depression, anxiety, mood swings, insomnia. But notice cold feet and frequent urination, even though the tongue is red, and slightly rootless coating. And not surprisingly, she did have a history of a lot of stress in the years leading up to the menopause, which are listed in these slides: husband's redundancy, father's death, and daughter's nervous breakdown. So, as we've seen earlier, the symptoms of insomnia, anxiety indicate that the heart is affected from a deficiency of yin. So there is a deficiency of kidney yin, but also heart yin with heart empty heat. Those are the points I used. Notice there's always the REM-A, lung 7 and kidney 6. And notice REM-4, nearly always have these 3 points. And notice 2 of my favorite points to calm the mind are DO24 and gallbladder 13. And spleen 6 also to nourish yin. By the way, I should say something about the use of herbal medicine and acupuncture. And probably this is a good place to say it. Herbal medicine is obviously better because it's not, especially when there is yin deficiency. Herbal medicine is better at nourishing yin than acupuncture is. But herbal medicine is better also because it's more convenient for the patient. The patient doesn't have to have so many acupuncture treatments and can just take the remedies. And acupuncture works very well to control the menopausal symptoms and to nourish kidneys. It does work. But the drawback is that the treatment has to be fairly frequent. I would say probably weekly. So from the convenience point of view, herbal medicine is better. So because of the heart involvement in this patient, I chose Heavenly Empress, with a very small dose of Is the Journey Young. And in this case, she came very infrequently because she lived far away. And as you can see here in this slide, acupuncture was very effective in her case, and it controlled her menopausal symptoms for a long time. But after that, I used only herbal medicine. Okay, let's leave this. So we nearly come to the end of the discussion. The last 2 points I wanted to make is the phytoestrogens and HRT. We don't have time to go into a long discussion of this. It's quite complex, but I've sent all of you a handout, so you have all these slides. You will also be sent, by the way, a recording of the whole seminar. I just would like to encourage you again to read the newsletter, which is on my website, the Three Treasures website, on phytoestrogens. And phytoestrogens are not estrogens, and they work in a completely different way than estrogen. And for a reason which would be take too long to explain, phytoestrogens paradoxically, well, apparently paradoxically, can work both ways. If a woman has a deficiency of estrogen, the phytoestrogen can stimulate it, stimulate the production of estrogen. But if there is an excess, phytoestrogens can actually reduce it by locking into the estrogen receptors, and they would have an anti-estrogenic effect. And this is not at all unusual in herbs. It happens very, very frequently. For example, if you look at this slide, dangui can contract or relax the uterus. Renshan ginseng can stimulate or depress the central nervous system. So it is not at all unusual. And I therefore consider that phytoestrogens are not contraindicated because they have a more homeostatic effect. And they're not at all, absolutely not at all like taking estrogen. And these are the foods which are rich in phytoestrogens: flax seeds, wild yam, soya products, of course, including tofu and sesame seeds. The other big question is the question of HRT, and you could actually spend the rest of your working life reading menopausal studies, in thousands and thousands of menopausal studies with contradictory conclusions. HRT helps heart disease, for example. HRT aggravates heart disease. HRT is contraindicated if you have breast cancer. HRT is not contraindicated. My personal view as a practitioner of Chinese medicine is always discouraging any hormonal treatment, starting from the contraceptive pill, the hormonal manipulation that is used in infertility, and also HRT, even though the dosage of estrogen in HRT is much lower than that of the contraceptive pill. And I just wanted to draw your attention to a couple of studies, some especially an interesting study and in this slide here I make the point that the menopause is not a disease, and unfortunately in Western medicine it is considered a deficiency disease. And unfortunately, some of these ideas are drug-driven. We have these drugs, therefore we have this disease. And the menopause is considered a deficiency disease which needs to be treated with hormone replacement therapy. I completely disagree with this view. From the Chinese point of view, the menopause is not a disease, it's a normal transition in a woman's life. And you can read this at your leisure from your handouts and also from the recording. And I just want to show you an interesting study that was done in the United States. The Women's Health Initiative, which is a very large trial in the United States to assess the risks and benefit of HRT on nearly 17,000 postmenopausal women. And they mostly checked the effect of HRT on breast cancer and coronary heart disease. And remember that some years ago, the prevailing view was that HRT not only controlled menopausal symptoms, but actually protected women from coronary heart disease. Interestingly, on May the 31st, 2002, after 5 years of the trial, they stopped it, which is unusual. It's not very often that they actually stop a trial, but they stopped it because there was an unacceptable increased risk of breast cancer, coronary heart disease, and stroke, which is very significant. And this is not at all surprising for me, but it's not surprising even from the point of view of Western medicine, because other studies reported an increase of breast cancer from HRT, as you can see in this slide from a Swedish study. And I remember reading some years after, what usually happens with these studies, they show an increased risk of breast cancer. Then maybe a few years later, they come up with another study, say, oh, but maybe that wasn't quite right, and maybe after all, there is an increased risk. I repeat, as a practitioner of Chinese herbal medicine, I would advise women always against HRT, especially in the long term. I believe that taking HRT for some months, it won't have any detrimental effect. But if it's taken for years and years, it definitely would, and I would discourage it. And that's why Chinese medicine is so great, because it can achieve more or less the same results, although more slowly, without side effects. Not only without side effects, but in a more holistic way, Chinese medicine would treat other symptoms that occur during the menopause. So this comes to the end of the webinar, and I just want, this slide here reminds you of some of my websites. The one, maciociaonline.com, is about online courses. And I have a blog. Every post on the blog automatically goes also to my Facebook page. I'm sorry some of you had problems with the poll. I'm not sure why. I'll try to correct it next time. So as I said, I've sent all of you a handout, and 7 of my emails were returned, so those people can get in touch with me. And you will also receive a recording of it. But because of the size of it, you will have to download it from a site. But I'll send you an email about that. So thank you very much, and good evening for those of you who are in Europe. Thank you very much.